touchless, contactless clinic where the patients and the treatment the touch and the contact will be minimized. First the patients come here, they will go through the sterilizing phase. Once they have done, then there is a digital weighing scale, and this is a weighing scale which will transmit into the records, and they will take the height with using a electronic digital stadiometer. Then they will use an infrared thermometer to measure the temperature, a pulse oximeter to measure the oxygen saturation and pulse rate. Here is the BP apparatus to measure the blood pressure, an electronic digital stethoscope to observe the heartbeats and the breathing, and an otoscope to look into the ear, nose and throat. Now let's take a walk at this one. We will see how is the patient flow. Here there is one patient along with the attendant walking in. Let us observe their flow. They will use their feet, sterilize their hands using a hand sanitizing agent, and from here the mother is taking her daughter to the weighing machine. While all this happening, the doctor is observing on the screen. So the weight is being checked. The weight is being checked, and let's see the weight. The weight is 46.5 kilograms. Let's see the height. Let's see what's the height. The height is 154.8 centimeters. Now they are measuring the temperature, and while this is happening, the doctor in his cabin is able to see the measurements. (96). Your pulse oximeter. This is transmitting the pulse. 99 is the oxygen saturation, and the pulse rate is 79. They are using a automatic BP device, and they will measure. They're putting it in the left hand and strapping it. It has to be kept at the chest level. And as we see, the doctor in the other cabin, and this is the patient's digital clinic. How much is the temperature? How much is the BP?
110 by 70.
110 by 70? Okay. So, this is something pretty interesting where they are using a electronic stethoscope. Can you remove the hand so that we can see that? Okay, the doctor is giving instructions that the patient's observation has to be on the back side, and the doctor is able to hear the heartbeats and the breathing sounds in his cabin.
Okay, done.
One, two, three, go. This is the high-tech, interesting part where imagology and ENT images are being taken remotely by the patient. So while you will see this is there, the doctor and the doctor's chambers will instruct the patient to take the instructions. Let's see what's the doctor saying.
Madam, please check the ear by using otoscope.
Okay, the doctor is saying that check the ears by using an otoscope. Now, let me go closer. They have cleaned and they have got a good image of the ear.
Okay, right. Please check the nose also.
They are cleaning it, and now they're taking a imagery of the nose. They're peeping inside the nose. Yes,
Okay, done. Okay, done.
done. The doctor is happy with.
Please clean it and check the throat.
So every time before using, they are cleaning the otoscope. And then here you go. And then we get a nice shot of the throat.
Okay. Done, madam.
And the doctor observes all this from his cabin. Now from here, let's move to the doctor's room. Here the doctor is able to see the patients and have all the parameters on his laptop. Now if the doctor so desires, he needs some more physical examination, they can do. Now the patient is walking into the doctor's room because they may need some additional physical consultation. And here is a barrier between them, physical barrier. So this particular barrier prevents the patient touch. And the stethoscope is on this side. Okay.